I think my producer will put the picture or the video of this young woman, Aisha.
Oh,
Aisha.
um,
The story of Aisha is
oh,
an amazing story. I really hope the whole of Africa can, learn something from Aisha.
Togo Madak.
Yeah.
You see, like I said, we have issue. Nigeria has not focused on developmental fund, on what you call focusing on measurable areas of development.
Mm-hmm.
There's a clear, measurable development trajectory, which is anchored on Human Development Index,
Mm-hmm.
which is health, education, and pulling people out of poverty.
Yeah.
These are measurable.
Yeah.
That's how you determine whether a country is working or not.
Yeah.
So when people come here and say
You said education,
health,
health,
education,
yeah,
and pulling people out of poverty. In fact, it's not pulling people out of poverty. We call it is per capita income. But I always say pulling people out of poverty, because the more the per capita income is high,
mm-hmm,
the more you know it is working.
and I think we can drop in security into this.
It comes into it because by doing all this,
Yeah.
you're actually doing the right thing. You know,
Yeah.
for me, education becomes most critical, because when people are educated,
Yeah.
they'll have good health.
Yeah.
They'll be put out of poverty. Because the more educated a society is, the more developed it is. Nothing else. There's nothing that's making the Western world better than Africa,
Yeah.
rather than education, proper education, because education brings everything. And when people ask me what did I do while I was governor, I said, I invested in human being. I invested in education,
Yeah.
because it was able, and I'm happy yesterday
Yeah.
that we just stopped at one place and we saw 3 people,
Yeah. Oh yeah.
all from a system of education that I built.
That was actually an amazing thing. Imagine going, because you were just showing me around and these people just came out of the blue.
I didn't divide them.
Yeah.
I didn't know them.
Yeah.
I was just there telling you that I built this, I did this.
Yeah.
And somebody said, I went to this school.
Yeah.
And the other one said, I went to this school.
Yeah.
And another said, I'm going to another school. And 3 of them, where I said I built it, said yes.
Yeah.
That they was there when I came.
It's an amazing thing. Going back to Aisha, I want people to know exactly this short story about Aisha, because
Well, Aisha was there. I was there. I didn't know her.
yeah.
But I've been talking about primary health care.
Yeah.
Because we have, like I told you, we have overtaken India in infant mortality. India is 7 times our population.
When you say
It was actually,
infant mortality,
that's children
children
dying.
dying,
Eh,
yeah.
So we actually projected to overtake India the way we were going by 2025. But this was a study done in year 2000. But we overtook India in year 2021. We were faster. So we have overtaken India. And the reason is because of poor primary health care. The foundation of health care is primary health care.
Yeah.
And Aisha works in what I call primary health care facility to Togo Madaki, where we went. I visited that place sometime end of February.
Yeah.
And you will not believe it. I saw 50 pregnant women being attended to only by Aisha. It was the only official staff. The others were people that are assisting our women. I look at the entire facility. It's in a poor state.
Yeah.
The delivery room where women deliver their child and no toilets. Just to give you an example.
Yeah.
You know what it means.
Yeah.
They have no toilet facility inside there. The roof, everything. So I told Aisha, I'm going to come back to give you money to see if you can fix those things. He estimated it will cost about 1.something million.
Yeah.
That's why I want to give her 2 million. And to thank Aisha for her sacrifice,
Yeah.
I give her 100,000. I intend to go back
To see.
that.
Yeah.
And that is the story of all the healthcare facilities across the country. 70% of them are actually not functional. And we need to fix this.
So.
And we need to train more workers like Aisha.
Mm-hmm.
We need to produce more nurses, more healthcare workers to be able to man this. And it's very easy to do. It's just to invest and prioritize where you need.
So, in other words, healthcare workers who look at Aisha can easily say, Aisha is like us. Even in silence, they might not get the opportunity, some of them might not get the opportunity to meet you personally like Aisha.
Some of the healthcare facilities not even manned. It's been overgrown by weeds. Is that bad?
And I don't know if that makes you the giant of Africa.
No, it's not just giant. I don't want to be giant of Africa. I don't want to be giant of Nigeria.
No, the country, because...
Oh, no, the country.
Yeah, they usually
No,
say Nigeria is the
of
giant
course.
of Africa.
I mean,